Testing, testing. Testing, testing. 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 Shit, battery.
Well, he'll be here by you. Yeah, so you can, yeah.
All right, so will you ask questions or you just want me to talk?
No, you can go ahead and talk and then we'll ask some questions.
Okay, so we're really glad to be here this afternoon, and we're preparing to open up what will be a screening site in Prince George's County. What we're hoping this site will do is to really expand capacity and allow us to be able to see additional patients and really relieve some of the strain that we know is sure to come for our urgent care centers and hospitals and emergency rooms. So this site gives us the ability to really alleviate some of that stress and strain. And how it will work is that we will route individuals through our health department. We now have a new telehealth virtual tool available for people to call when they feel they have symptoms, to speak with a nurse practitioner or doctor. That person will then make an appointment if necessary. If the person meets the CDC guidelines for testing, those individuals that will then be routed over to this screening facility where they can be screened, and on a minimal basis we will also have testing available for those individuals as well. This is really important to us because during this time we want to make sure that we're able to accommodate individuals who are both covered by health care and have physicians, but we want to be ever mindful that there are about 50,000 individuals in Prince George's County who do not have health insurance, and we want to have a place for those individuals to be able to be seen and to be cared for, as well as we expect to have a number of our frontline individuals, our first responders, maybe even some physicians themselves who will need appointments to come here to be screened and potentially tested. So that's what this is about. Certainly this is in collaboration with the state. Obviously, I really want to thank Governor Hogan and his administration for the support that they have given us in bringing. We have here the National Guard. We're also working along with the University of Maryland Medical Facility. So this has been a collaborative effort, but I really want to thank the governor for his leadership and for acting swiftly to make sure, again, that every one of our Prince Georgians and Marylanders has the opportunity to have health care and to be seen at this time if necessary.
So Laurel Hospital, has that reopened?
So Laurel Hospital, we're about 3 to 4 weeks out. That is one of the facilities that we are also, that the governor and the state has decided to reopen some closed parts of it. Also, again, to expand bed space and capacity to be able to see patients should we expect a surge as expected in the next few weeks. So Laurel will be one of those facilities, but we're about 3 to 4 weeks away from having that open and ready as well. So in the meanwhile, this is one of the facilities we have.
Okay, so this is a testing site, and it's the kind of place where people can come first. They don't have to go to the hospital. This isn't an overflow, is what I'm saying.
Well, you know what, but this is appointment only. I do have to stress that because of all of the social distancing requirements and such. We don't want people just driving up here. We do want them to be screened first. They will then be, according to the CDC guidelines, if they need to be brought here, they will be brought here instead of, you're right, going to urgent care or going to the hospital. We will have them come here, but this is appointment only because, of course, we want to avoid a situation that becomes even more dangerous. If we have large numbers of people who just show up at this facility, we do not want to create an unsafe situation for our residents. So they must be screened and come by appointment only.
So for point of clarification, you asked, this is a testing site. Again, we're driving on the point, it's a screening site.
It's screening. Yeah, this is a screening site, and we also will be testing. There will be some limited testing, but everyone's aware that part of the real challenge that we're having in the state and really across the country is the availability of those testing kits. And so we're waiting for the federal government to continue to release more and more testing, but that's a real challenge that we're having here in the state and in Prince George's County is the availability of those tests. So that's the reason that the screening is so important, and according to the CDC guidelines, our healthcare professionals will then determine which individuals are appropriate to also be tested rather than just screened.
Okay, so the health director said when he was talking about this a couple of days ago that you all were waiting on more tests from the state.
Yes.
That tests could be offered here. But now this is going to be screening. And then if they're okay for a test, will there be a test here, or will they be sent to?
Yes, they will be tested here as well. So what we're still awaiting those test kits. The state is as well. The state is waiting to have those kits arrive from the federal government, and we're hoping that by Monday, we're hoping that we'll be able to have. It's on a day-to-day basis. The state is also waiting. They want to make sure that they have an appropriate number of test kits available before we start sending people over. So this will primarily be a screening facility. But we will have some limited testing available here as well. So we will have those test kits as they arrive available at this site to test people as well.
And when will this be up and running? When will this be open?
So we're hoping that we'll be up and running by Monday. That's what the plan is at this point. And again, it is on a day-to-day basis based on the availability of those tests. But right now, we're fully ready. We were able to stand this up again with the assistance of the state and the National Guard, and also the University of Maryland healthcare system has assisted us. As you can see, we're ready. We're ready to go. We really just need those test kits. We have the telehealth virtual app that's all ready now so that we can screen people and send them over. But we're ready to go. We just need the test kits, and we'll be ready to get some people in here.
What will the hours of operation be here?
The hours, I believe, are 10 to 3. The hours are 10 to 3.
And how many patients can they see here?
Well, you know what? We are able to see a good number of patients. We're hoping that we'll have about when we talk about the test, as the test arrive, I believe the plan is to be able to test about 100 individuals each time we set up. And in terms of the screening, that's just by appointment, and it depends on the number of healthcare professionals. We have the medical reserves who have been really beautiful to work with. They're going to send out some doctors who will be volunteers. We're working also with the Army, who will be out here as well with some doctors. So we're working with Andrews Air Force Base, and so we'll have the number of individuals we need here to test, and we'll just see, from 10 to 3 how many we can get in.